John. My name is Donna Buna. I'm a pharmacist that works at Island Health. So I understand you're going to be coming into one of our hospitals and you're concerned, have some medication concerns.
Yes, I'm a medical user of cannabis.
Okay.
And having discussions with people, I wondered how that would be framed when I brought that into the hospital environment. Can you give me a little bit more information about what do I need to do? Will it be taken away from me? Will I be able to use it on my own?
Sure. It's very important that the team know that you use cannabis for medical purposes. We need to know right off the bat if you have a medical authorization to use it for medical purposes. As you know, cannabis is legalized now, and some people will use it for non-medical purposes, but you, I understand, are using it for medical purposes.
So could I ask you right there, I need to bring in something that is from my doctor or the physician that has given me this as something that I can take in a medical way?
Yes, so there is a medical authorization. So to prove that you legitimately are using it for that purpose. There are some people who do use it for medical purposes. They self-treat and they don't have that medical authorization. And it's just important for us to know about those people. But unfortunately, we can't use their product because of the legalities around it. But the team needs to know, and then the team can come up with a plan about whether they try and obtain medical authorization or they might use different medications if there's symptoms that need to be controlled. But I understand for your case, you do have medical authorization. Is that true?
That's true, but there's a caveat there because
Yes.
I can bring what I got at a store, or I can bring what was given to me medicinally, and it would be in a container, and I could show you that container.
Yeah. You need to bring that in too.
So that's what it'll come in if it's
Right.
not medical. Now, if it was medical, it would have my prescription number on it. And so do I need to have I can't bring it in a plastic bag?
No, you have to bring it in. If we use it in our facilities, you have to bring it in the container that it comes in with the prescription label on. And that's how our pharmacy staff approve it. So they look for the medical document, they look at the label and make sure everything's in place. And then we kind of use it like your patient's own medication. And so you need to bring it in so we can use it in the hospital, and we have procedures that we follow with nursing and pharmacy. The doctor will have to order it, and they'll have to order the specific cannabis product, the specific dose, the specific route. And at present, our policy only allows oral or topical oils. Just recently, edibles have become legal, but the federal government hasn't got around to the legislation that guides us on what edibles are legal and what are not. And until that time, we don't allow edibles, but eventually there'll be a policy written around it.
So let's say that I come into the hospital and I don't tell you that I have cannabis tucked away in my pocket and that I somehow am able to store it. What will happen to it? Will it be taken from me, or will it be like I can understand from a professional's point of view that this is now medicine and it needs to be given in a way that a doctor or a physician has determined is the manner of doing that. But it's also that sometimes I'm in situations where it is in a plastic bag, and it is something that I've just brought in because it goes with me everywhere.
Or you may have an authorization to grow it yourself, or you may have got it from just from a recreational source. And if you bring it in on your person, that's considered your personal property. Just like if you brought in your wallet or a piece of jewelry, or maybe if you're a smoker, you had cigarettes, that's considered your personal property. And so you are responsible for storing it securely, or what we recommend is you just send it home so it doesn't get lost, or it doesn't get, maybe another patient might discover it or something. So safety is the key, right? We have to store it securely. And if you can't, the staff can help you and then give it back to you when you go home. But it is your personal property. So we wouldn't take it away from you and throw it away.
Yeah, that's good. That's good to know, because I would suggest to you that it's similar to a cigarette in the sense of cigarettes are those kind of things that you go off-site to be able to smoke them, and a lot of people still determine that they need that particular thing. And with cannabis, it may be the question occasionally for people that come through the doors.
Yeah, it does kind of align with that wanting to go smoke a cigarette. And we do have a smoking policy, which people are obviously aware of, that they're not supposed to smoke or vape within a certain distance from the hospital, but people do go out and the staff won't stop you. It's your own personal use. It's just the security in the facility. And like I say, the safest thing is to send it home, but if you want to keep it for your own personal use, and maybe if you're well enough to go off property a bit, that's fine too.
Well, I appreciate knowing that, because I know that if I brought a Mickey of alcohol in, it would be a similar situation. It's like, we're going to tuck this away for you.
Yes.
You can't really be drinking. And from my perspective, I would like other people to know that the reason that you're doing this is to help the person who is looking after me, the professional, but it's also for my own benefit too, that you want to ensure that I'm protected in a way that it won't be lost, that I'll have that access to it when I leave again. And probably the best way is probably go to my doctor and ask for medicinal, so that I can come into the hospital, freely bring it in. Everything is dealt with in a pharmaceutical way, and I'll be given that medicinal product when I need it.
Yeah, and then everything's up board, everything's recorded, because cannabis does have pharmacological actions, and so we need to know. We need to know, and that is definitely the best way to do it. But we appreciate that some people don't have that authorization, so the team can make calls and have conversations with you and make the best decision for you, and hopefully your hospital stays short. And
so how is that for the professionals? We've moved. This move with cannabis has been huge, and on the side of someone having that come into an environment where everything is regulated for the benefit of my health. Are they comfortable with being able to deal with this now? Do they understand what it is? Do they have enough education that they're just going to be able to, like you suggested, it'll be going to the pharmacy and they will have a knowledge of that, and people who are dispensing it to me will have that knowledge to be able to do that?
The organization, in my opinion, of course, has done a really good job of supporting the staff with this change. It is very complex. There's a lot of gray areas, and it seems to change all the time. We have a very comprehensive web page on both the public site and the intranet for the staff. We have
So they all have access to that.
They all have access. We even have a Ask About Cannabis line where they might be in a situation where they're not sure which way to go. Professionally, clinically, legally, they can email the line and they can get a response from a bunch of us who have been working a lot on the policies and procedures of cannabis. And the organization is already revising our procedures it's approximately a year since it's gone legal, because this is a rapidly changing area, as everybody knows, with edibles coming and various data coming forth. So the organization has been very responsive and tried really hard to support the staff. There's always someone who may not have gotten to the website or whatever, and might not have all the information, but the information is there, and the staff, we've done a lot of education around it.
See, and that's helpful to me, because I have friends who may not be in as good a situation in life as I am, and it's become part of their daily process. And if they come in, there's a fear that it will be taken away from them, or they will not be able to have access to it. But it sounds like they'll also be able to have a conversation that, maybe it's best that you work towards the medical situation, so then you can always have access when you come into a hospital, but it will not be taken away. It'll be given back to you when you...
Yes, both. That's a scenario for both medically authorized cannabis, where we'll be using your product, we'll always give it back to you when you're discharged, and non-medically authorized cannabis. It will be stored securely in whichever best way and always given back to you. Now, there are scenarios where people get discharged and they forget to give it back to them, or they forget to ask for it, and usually, and what ends up happening, it's a similar thing if they bring in their own meds and then they go and they forget to take them home, is they're often sent down to pharmacy. We'll hold them for a little while, we'll make an effort to get it back, but eventually, if after a period of time, a couple of months, we will sometimes end up destroying these things just because it's legally we have to destroy them. So it's a good piece of advice for you or any of your friends when you come in, when you leave, to ask for it back.
Yes.
Because you know how busy the staff can get. They try and think of all the things that we need to do to get you home, but it's good to remember to ask.
Well, thank you very much.
Yeah.
That's given me a good overview of what's happening internally and externally, and allows me to be able to make that decision about how I am going to deal with it, and probably consider that now that it is a legal product, that I go to my doctor or I go to a clinic and I get that as medicine, and then I'll be able to deal with it in a hospital environment in a very positive way. So. Yeah,
you'll continue to use it just like you used it at home in the hospital. Do you have any friends that are in long-term care facilities at all?
Absolutely, yes, there is. And I will say that there's been a real increase with seniors in using cannabis. So
apparently the latest stats is 4 times more than in 2012. So
and so you got the same situation, and if the hospitalization, that will extend to long-term care. They would have the same sort of policies that... that you can have medical authorization, then the nurses will give it. But if you don't, you need to store it securely in your room in long-term care, and you can use it. Once again, no smoking and vaping, but a lot of people are using, oils and things like that, and you can use it because your long-term place is your home. So it's like you're at home. Well, I do appreciate the protocol, because what it does is allows us to shoot for, let's try and do this right, because it is a brand new thing on the market, but it's been around for a long time, and the perspective that some people have is very different than the legalization piece. So thank you very much for all that information. Good to know.
Yeah. I answer all your questions. Do you feel like you know what
believe I
you
feel
do?
very comfortable about that, and I think probably the most important thing for me is, yes, I know I can bring it in, but I also want those people that are behind the doors to be able to feel comfortable with it too, because I know that it was framed in a different way before legalization, and now it's a big step for them to have to accept something. So with their understanding, the education that you've given them, I think that fits both sides of the equation.
Yeah, they just want to do the right thing. I think if it's a planned admission, you likely will if it's a planned surgery or something, you will have a lot of prep before you come into the hospital. They'll do a medication history. They'll ask you about cannabis at that time. If it's not a planned admission, then you will have to let them know as you come in the door. Right?
So that's a good question. My medication history, which is something that when I come into the hospital that I should have, and cannabis should be listed on there. So when I do leave, then they'll recognize that when we do that reconciliation, that they'll be able to, cannabis will be on there. And if I was bringing it in and it wasn't medicinal, they would know that that's there, and they would be able to have that conversation with me that you need to take. And that's helpful for me as the public, knowing that I need to have all that information about what is part of what I take every day, whether it's supplements, cannabis, or medicine that's been prescribed by my doctor.
We just need to know so we can make good decisions to take care of you. Yeah.
Thank you.
Yeah, you're welcome.
Yeah, very good.
Yeah.
Yeah, good.
Hey, thanks, John. We've got it figured out.